we'll go ahead and get started. So, good afternoon, everyone. I am Albert Ayson, AAPCHO's Program Fellow, and on behalf of AAPCHO, I want to welcome you to today's webinar titled Civic Engagement, the Role of Community Health Centers. Today's presenters are Lindsey Ruivivar and Yvette Ammerman from the National Association of Community Health Centers. We are privileged to have them speak about the impact that civic engagement has on community health centers and the patients they serve. This topic is especially relevant with the upcoming election in November. Furthermore, it is AAPCHO's overall goal to promote ongoing civic engagement efforts at health centers year-round. Today's agenda will include the presentation, followed by a 5 to 10 minute period for question and answers. Before we start, I want to quickly mention a few housekeeping rules. First, please mute your devices during the presentation portion of the call. Second, please take a moment to take a look at the right side of your GoToWebinar screen. And if you have questions during the presentation, we ask that you please submit them via the chat function on the right-hand column. You can submit your questions at any time during the call, and the chat function works similarly to instant messaging, so please remember to press send to submit your question. And during the Q&A session, we will prioritize those questions submitted via the chat function before we open up the phone lines. And lastly, a recording of this webinar, along with the slides, will be available within the next 48 hours. So please feel free to share this information with your colleagues and organization. With that, I'll pass along the meeting over to Lindsey and Yvette.
Thanks, Albert. This is Lindsey Ruivivar with NACHC. And first off, I just want to thank AAPCHO for giving us this opportunity to do this webinar today. We're really excited to partner with AAPCHO and to promote health center civic engagement. And then second, thank you to everyone who's on the line today. Thanks for your time and your interest, and we look forward to keeping in touch with you after today's webinar and learning about all the great civic engagement opportunities that you'll be pursuing at your health centers. So as Albert mentioned, here are today's topics that we'll be covering. I'll be talking a little bit about voter registration and what Yvette and I have seen health centers do across the country this year. And then Yvette will be talking about voter education and voter protection. And finally, we'll wrap up with Get Out the Vote, kind of talking about how can you go beyond just voter registration, but actually increasing voter turnout in your community. So we're really excited about Community Health Vote. This program was started back in 2008, and really, we truly want to assist health centers with civic engagement, not only voter registration, but again, how can we actually increase voter turnout in our communities? And I'll be talking a little bit in a moment about why we think that is so important. And I also wanted to mention up front here, this is a totally legal, permissible, nonpartisan activity that health centers can participate in. And we'll talk in a little bit about what exactly does it mean to be nonpartisan and how can you make sure everyone on staff is really well educated about being nonpartisan. We know that low-income communities typically have low voter turnout. There's a lot of data out there that's of interest to us because many health centers are serving those lower income communities. And so we just feel like health centers really can play an important role in offering this service to our patients. I love this image that you see on your screen right now. I think this is so interesting. This was put together by one of our national partners called Nonprofit Vote. And what you're seeing on the screen is a picture of the city of Cleveland in Cleveland, Ohio. The center part where you see the lighter shaded areas, kind of the tan color, that's downtown Cleveland. And as you spread out and you get into the darker areas, those are kind of the suburbs around Cleveland. It turns out that the lighter areas on the map is where there is a very low voter turnout. And in the darker areas, there's a higher voter turnout. And if you see all those little round purple dots on the map, you'll see that most of them are clustered in that low voter turnout area. And it just so happens that all of those dots represent nonprofit organizations. So we know that nonprofit organizations are located in the areas where they're serving their constituents, or in a health center's case, where you're serving your patients. So again, this just really highlights for us that we know that a lot of health centers, a lot of nonprofits are located in those low voter turnout communities. Of course, we also know that our patients and our organizations are really impacted by decisions that elected officials make, whether it's local, state, or federal. So what can we do to not only ensure that our voice is heard as health centers, but also to give our patients a voice and let them know that their voice matters and that they count, making sure that they understand that, by voting, they are participating in the process and they do have a say. Programs that they depend on, whether it's your health center or a program such as Medicaid or Medicare, those are all funded by decisions that our elected officials make, and so we really depend on that. So a couple of things we just wanted to cover, some rules, some do's and don'ts. What can we do as nonprofit organizations? And there's a lot of things that we can do. We can do voter registration. We can do voter education. We can help people on election day. We can help get them to the polls. You can even support or oppose ballot questions. So if you have a local measure on the ballot, whether it's for funding or some other kind of decision locally that's considered a ballot question, you guys as an organization can come out for or against those. But there's a couple of really important things that we can't do. And if you don't take anything else away from the presentation today, I hope you at least remember to take this information back and share it with everyone on staff. Because if your health center is going to offer voter registration, inevitably certain questions will come up. And so a question such as, if you have a table set up in your waiting room with voter registration forms, and a patient picks up one of those forms and they walk up to your front desk receptionist and say, hey, I'd like to register to vote. Who should I vote for? That person at the front desk needs to know what is the appropriate way to respond to that question. And the appropriate answer would be, we're not here to tell you who to vote for. We're not going to tell you to vote for one candidate or another. We just want to encourage you to vote. And so, again, just making sure that as you start rolling out voter engagement activities at your health center, make sure that everyone on staff is very well trained and understands that as a health center organization, we're not going to endorse a candidate for office. Really helpful to let them know. Anything to do with a party, any political parties, we just cannot be involved with that. And so when your staff are at the health center, when they're on the clock, they are representing your organization. And that means that, if you have a casual Friday, when they're there working at the health center, they can't wear any political buttons or T-shirts. They can't wear, an Obama for president or a Romney for president sticker, anything like that, because they're representing your nonprofit organization. So if we have any questions about this, we can definitely cover it again at the end, but I just wanted to make sure we were really clear about that this is a nonpartisan activity that you'll be offering at your health center. So how do we do it? Wanted to share a couple of ideas as you're creating your voter engagement plan. What have other health centers done? How are they successfully offering this? Who are they partnering with? So just a couple of tips I wanted to go through. So first is to get organizational buy-in. The health centers that we've seen be successful, even if it's just one person, whether it's a staff person, an intern, or a volunteer who's really leading the charge on the effort, they got the buy-in from everyone else, whether it was having their health center board pass some kind of statement saying that they support voter registration activities, making sure the CEO is on board, and other staff just to support the effort. Next is to check your state's voter registration laws. And Yvette is really going to highlight later on why this is so important, because there's so many things that vary by state, whether you can do absentee ballots, what are the voter registration deadlines in your state, primary elections fall on different dates. So these are all really important things that you need to be able to look up for your state just to make sure that you incorporate it into your plan appropriately. The next is to train staff. And this, again, this goes back to, making sure that everyone's clear what it means to be nonpartisan, even if it's a staff member who maybe isn't going to be directly involved in doing the voter registration effort. Another great thing to consider is to reach out to your county board of elections. And this might not be an obvious one, but I know a number of health centers that that's one of their first starting places. Even after you find out what your state's voter registration regulations are, at the end of the day, every county tends to operate a little bit differently. So it can be really helpful for you to reach out, make a connection at the County Board of Elections, let them know that you're going to be offering voter registration and that you're a non-profit organization. And I've heard from several health centers this year that when they did that outreach, they found that their Board of Elections was really helpful, even offered to send staff in some cases out to the health center to train the health center staff, to train them how to fill out a voter registration form correctly, provide materials. I had a great opportunity myself to visit with HealthPoint, which is a health center in Seattle, Washington. They had their County Board of Elections come out and do a training at the health center with their staff. And this Board of Elections even offered to track for the health center how many forms they turned in, and then after the election to kind of run a spreadsheet for them to show the health center, out of everyone you registered, here's how many of them actually voted. So lots of great resources there. Make sure you reach out to the Board of Elections. Another thing to consider is to maybe partner with other organizations. This can be particularly helpful if you feel like maybe you don't have enough people on staff to kind of organize your effort and track those voter registration forms or assist patients with registering to vote. I know a lot of health centers this year who have partnered with the local League of Women Voters. That can be a great source of volunteers. As we're getting into the fall, I know another great source can even be college students. So a number of opportunities there. It's just really important that whoever you partner with, if you're going to bring in another organization or bring in volunteers, they have to understand what it means to be nonpartisan too. So just be careful there. Also make sure that you incorporate into your plan to track those completed voter registrations. I'll be touching on a little bit later during the Get Out the Vote why this is important to help us actually encourage people to vote after they've registered. But this is also going to be really helpful for you just to measure your effectiveness and say, what worked, what didn't work. We also ask that you share those numbers with us. If you could share them with AAPCHO and with NACC. At NACC, we're trying to track the efforts nationally at all community health centers. So we have a national tally of how many people have been registered to vote at community health centers this year. We'd love to be able to include your numbers in the tally, so please send those numbers to us. Next, use pledge forms for follow-up. This is something else I'll be touching on later, and again, has to do with Get Out the Vote. And that's the last piece of creating your plan is, again, making sure that we're not just thinking about voter registration, but also engaging people to actually increase the voter turnout in your community. And I know that right now, we're already into September. In a lot of states, the voter registration deadline for this upcoming election is around October 7th or 9th, depending on what state you're in. So there's still time to do efforts this year, but even if you feel like you can't get your voter registration drive off the ground this year, you can still do the Get Out the Vote phase and encourage people who are already registered to vote to actually get out and vote. And we hope that you'll kind of take this plan and make it an ongoing effort year-round so patients know that they can come to your health center not only for health services, but also for, to register to vote. So next, if she's on the line, Albert, I don't know if you can open up the lines here, but we were hoping to have someone from International Community Health Services share with you all how she has been doing voter registration. Max, are you on the line?
Yeah, so unfortunately Max is not on the line.
Okay. Hopefully we can get her on the next webinar. But this picture that you see on the screen right now, this is a picture from International Community Health Services. They have a consultant there through one of their grants that they obtained. Max Chan is helping to do voter registration. And so one of the tips I wanted to share is to start with your staff. And this is something we've heard over and over again from health centers, is that they'll start doing voter registration, and their intent is to register patients in their community to vote. But what they find is that a lot of their staff are not registered to vote. I can't tell you how many times I've had a health center tell me, yeah, we set up voter registration in the waiting room. We told all of our staff what we were going to be doing, and people got excited. And we started having staff people come up and say, hey, can I register to vote too? So I think this can be a great starting place for your organization, not only to get everyone energized, but to also, going back to the whole idea of why are we doing this? We want more people to have a voice and to be engaged as voters, engaged citizens. So consider starting with your staff and offering them the opportunity to register and vote. Next tip is to incorporate your voter registration into your existing operations. This picture is from a health center in Wisconsin where they put up a nice sign and they have forms in their waiting room. And so there's a lot of different ways you can do this. Most health centers somehow incorporate voter registration into the intake process. So maybe you have the forms with your front desk staff and they're reminding people to register to vote, or maybe your outreach and enrollment staff, if they're helping somebody sign up for Medicaid, maybe they could also help a patient fill out a voter registration form. I just got an email today about a health center in Colorado, and I thought this was incredible. They have 15 sites, and they have a call center where people call in to make their appointments. And so they created a script for their call center folks. So after they're done talking with a patient about scheduling their appointment, then they ask that patient, hey, are you registered to vote? And if they say no, they just let the patient know, you can come into any of our health center sites and register to vote. And they're also offering to sign up those patients to get voter reminders. So there's so many options of how you could incorporate voter registration into your existing operations. And of course, it just depends on your organization and what works well with your staff. And then the final tip I wanted to share is this isn't just about registering new voters, but keep in mind people can also use a voter registration form to update their voter registration. We have found, you guys are well aware that a lot of health center patients move frequently. And as patients come into your health center, usually when they go up to the front desk and check in, your front desk staff is automatically updating their contact information, and they're asking that existing patient, do you still live at this address? And if they say, no, I've moved, I need to update my information, that could just really easily be a red flag for that front desk staff person to say, oh, do you also need to update your voter registration? So again, something you could just incorporate into your everyday operations, and patients will become familiar that they can come to your health center and update their voter registration form. So again, it's not just about voter registration, but we're also talking about voter engagement today. And now I'm going to go ahead and turn the call over to Yvette Ammerman, and she'll be talking about some of the other ways we can engage with voters.
Good afternoon, everyone. I'm Yvette Ramirez Ammerman, and I'm Associate Director for Western Operations with the National Association of Community Health Centers, or NACC. I'm based out of Albuquerque and more or less work in the southwestern area, and I just really want to thank you guys for joining us. I know you all had hopefully a lovely long weekend, and to jump right back into things with a webinar is not always easy, so we appreciate your time and joining us today. I'm going to start off by talking about voter education. Next, Lindsey. Okay, so why is this important for community health centers? We're located in communities with low voter participation. So traditional voter outreach efforts don't reach our patients. Young voters, minority voters, infrequent voters. So if any of you have ever been involved in a political campaign and done the door-to-door canvassing, you'll know that they give you this piece of paper that shows everyone in a neighborhood who has actually voted. And you look at that piece of paper, and it may be 1 out of every 4 houses. So what happens is you skip all the other three houses and you go to that fourth house of someone who's actually voted in the last couple of elections, which means that our folks who may or may not have voted or don't vote frequently or may not have been of an age to vote yet, those folks in those houses are skipped. So they don't even get the same access to information that other people who consistently vote receive. So it's really important that because they come to us as trusted resources, that we are actually able to give them solid, consistent, nonpartisan information. The other thing is that traditional voter campaigns are really focused on one voter cycle, one voting cycle. So let's say you were, walking the neighborhoods for a particular woman running for senator. She really doesn't care so much once she wins the election. We, however, have a whole different view of things. We really care about the long-term health of our community, and this is really the underpinnings of the community health vote effort, is we care what happens the day after election day and the next election and the next election, and we really want to make it part of our operations that we get our folks, not only our staffs and boards, but the people that we serve, we get them to care too. And then, of course, we are trusted resources. And the thing that I love about us being able to be nonpartisan, or having to be nonpartisan, rather, is that it kind of keeps us above the fray. So, when people start to talk about politics, it often gets kind of ugly. We're above all that. We can say to people, we don't care how you vote. We just care that you vote and that you're an informed voter. That's all we're here for. Next one. So this is just a quick overview of some of the stuff that I'm going to go over. Lindsey already touched on it. You've got to start with your staff, have a key point person or a team of people that are very knowledgeable. This is so that when these questions arise, that person can answer them. There's a lot to take in, and you want to have at least one person or a team of people that maybe have different content areas, that those people are kind of the resident experts, and when questions come up, that they are able to answer them or know how to get them answered and have the resources. I think we've already mentioned nonpartisan. So if someone comes up to your table and says, I don't know what I am I a Democrat or a Republican, you actually hand them information with both parties represented in contact information. So you say, I'm sorry, I can't tell you that, but here is how you can find it. Use really plain language, and of course, you all know this better than anyone else. Use many languages. I visited in Northern California, and I think one of the community health centers was dealing with 33 languages. And of those, they had 5 languages that were the majority languages spoken, and it was really tough. So as much as you can, get your materials translated. There's different ways to educate, and I'm going to go through this a little more thoroughly in a second. Implicit and explicit, and we'll talk about that. And then the last one is making it local. Be aware of what really matters to your community, because as you try to do community education, you're going to need to keep those things in mind, because it's a hook. It's a way to engage these people in a conversation about why it's so important to register to vote and vote. Next. So, talking about the passive or the implicit process, what you can do are the first 3 things that are just very, they're nonverbal. You post November 6 posters. You display registration information very visibly in your offices and waiting rooms. You have voter registration widgets on your website, and if you need some help with that, Lindsey's your woman. And then we had a great example on a recent voter registration teleconference. One of the clinics had decorated their whole clinic in Independence Day or 4th of July decorations. And it was real festive and great, and people kept coming in and saying, so did you miss that it's not 4th of July? Is there something you're missing here, or am I missing something? And it was just such a great opportunity for them not to have to ask people as they came in, do you want to become a voter? Or do you want to register to vote? They were actually, folks coming in actually asked them, so what's going on with this? And it was just a great entree. So if you can think of things that pique people's interest. That's a wonderful way to get started. You mentioned the availability of voter registration and voter information in your censor's newsletter or inserts in your patient's mailings or newsletters that you send directly to them. Give information on early voting locations and vote via mail or absentee ballot. Have those request forms right there in your clinic. A lot of people just won't take the time to request these, and I'll talk a little bit more about those requests and some of the issues around that. Distribute sample ballots. This is a really great one because walking in cold to vote for the first time, let's say, it's very confusing. You're handed this ballot. It can be very confusing. If you have a little bit of time to actually look at it, look at different ballot measures, just kind of absorb it, that's a much easier way to walk into the voting polls on election day. Use social media to remind your folks of important deadlines. Text, Twitter, Facebook. Put election date and 800 voter helpline in your email signature. That's a great one. Advertise rides to the polls offered by your community health center or others, and Lindsey's going to talk a little more at length about that. Coordinate with nonpartisan partners on your issue to send questionnaires to all candidates. And I say coordinate with nonpartisan partners on this one, like League of Women Voters or NAACP, mostly because in an election year is not a great time for a 501c3 to actually begin doing questionnaires. There's some issues around whether or not you look like you might be supporting one candidate over another, and we're not allowed to do that in any way, shape, or form. So get a partner to do it. Get someone to do the questionnaires, and then you can hand them out in your waiting rooms. Hold a candidate forum, and make sure that if you're going to hold a candidate forum that you invite everyone running for office. You can't not invite people. Now, if they don't show up, that's fine, but you have to invite everyone from every political party. Contact the election department to register to be a polling site. I love this one and the next one. These are the things that make me happiest when I find out that one of our community health centers, already located in just the right place, is actually becoming a polling site. The biggest reason is that voting is intimidating for our folks, and I'll talk a little bit more about that in a second. But it's intimidating, and if they're actually able to go to the polls at some place they feel comfortable, that speaks their language, that they trust, that is a great way to do it. Having a voting machine in your waiting room before the election to train people is wonderful too. I love this one. You probably have to contact your Secretary of State to find out if you can. But the thing that I love envisioning is people who are intimidated by voting or don't think that they know how get to see what it looks like. I love the idea of kids crawling all over the voting machines and just really making it more of a friendly environment. And I don't have this on here, but I wanted you to know that a lot of people are using their promotoras or their lay health workers to get out information and education on registering to vote and voting. And I think that that is a great way to utilize your resources. Those are people that have deep roots in the community and are often the trusted resources within the community. So that's another great way to handle it. Next. This is taken from our Community Health Vote Toolkit, which is located on the saveourchcs.org website. And what I like about this is you could post this. You'd have to personalize it to your state for whatever laws are regarding your state. And I like this because you could put a big poster of it, and it takes the embarrassment out of asking some of these questions. I know with our immigrant populations, a lot of people have said to me, we really don't feel comfortable asking them if they're a United States citizen. We don't have to ask them that for them to receive health care. It feels uncomfortable for us to ask that when they're registering to vote or wanting to register to vote. So if you actually just have this and say, you can hand it to them and say, hey, if you meet all these criteria, then please just check the box, yes, I'm an eligible voter and I'd like to register today, and then you go from there. You certainly don't have to ask them if they're, serving or on probation for a felony conviction, those types of things. It just sort of eases the process. So that's one option. Next. Okay. So one of the things about voter education is that just as you provide effective health care, effective voter education really means knowing your community. Some of the feedback that we've received is that many of the folks that we serve don't believe that their vote matters, or they're very distrustful of government or very disaffected. And the people that I've shown this poster to just love it. And just a couple of the things, whoops, hang on, I almost got a webinar here. One of the things, it says, I can't afford insurance, we need jobs, taxes are too high, stop killing the planet, when will what will retirement be in my future? And then the caption at the bottom is, vote and earn the right to complain. And a lot of people really get a kick out of this because people do walk in complaining, and you ask them, well, did you vote in the last election? And they say, no. Like, well, you don't get to complain then. You could have made a difference. And then the last slide sort of sums up the underpinnings of this part of the presentation. Your vote is your voice, and if you don't vote, pretty much what you're doing is giving up your voice and giving up your chance to make a difference in your own life. So it says vote or shut up and do whatever we say. Okay. I think I will just go ahead. Do we want to take questions just at the very end? Is that what we decided?
I think we'll be taking questions at the end.
Okay. All right. Then I'll just power on. Voter protection. What does it mean for community health centers? Next slide. Voter protection requirements so that your folks cannot be intimidated or prevented from registering to vote or voting. So there's some basic rights that are assured on a national level. And then, of course, there's going to be requirements that are particular to your state. And I'm going to go through each of these areas. There are things that I just want you to have on your radar screen for you just to be aware of. But by no means are all of these things your job to be on top of. There's tons of groups that are watchdog groups who can take complaints, who can help you out. In fact, this one, this particular presentation is by a group that we work with called the Fair Elections Legal Network. And they really work hard to make sure that laws are followed, people are not intimidated, and make it as easy to vote as possible. Okay, so next one. I'm not going to go through each of these specific areas, but generally with absentee voting, it varies tremendously by state. Some states, you need an excuse to vote, and it may be because of business, or you're a student, or you were ill, you're taking care of someone, pregnancy, you're awaiting trial, you're a member of an electoral board, your religion. All of these things are reasons why you may be able to request an absentee vote in your state. We also have some states that allow anyone to get an absentee vote, voter ballot without any specific reason. So those are great states. New Mexico just passed that law, so we're excited about that. Next one. ID requirements. This is a big one that you all have been hearing about, certainly in the national press. Again, tremendous variation by states. Sometimes your only ID that you need to vote is a voter registration card. Sometimes Social Security card, driver's license, federal government ID, student ID, employee photo card. It can also be current utility bill, bank statement, government check, paycheck. So all of these are potential ways that voter ID, you have to see what it is in your state. And you also have to look at, Is it just the first time that you vote that you need to bring ID, and after that you do not need to bring any kind of ID, you just give them your name? All of those are potential pitfalls for our folks if we don't warn them in advance. And then the highlighted, the bolded area, those who don't provide ID will have to vote provisionally and may result in the vote not being counted. What we found is that provisional votes have a very high rate of not actually being counted. So to the best of your ability, not voting provisionally is the way to go. Next. Okay, these are special circumstances which you should be aware of in your community health center. Survivors of domestic violence. You should know that voter registration rolls become public information once someone registers to vote. So certainly if I'm a survivor of domestic violence and I don't want the abuser to find me, if I register to vote, I want to find some way to make sure that that does not then become public information. Each state is different about this. Many states have passed laws so that if you indicate that you're a survivor of domestic violence, that they actually will not release that information in any way, shape, or form to the public. So knowing about that is important. And if you have questions on that, I've also provided the resource right underneath to be able to call them and find out what the situation is in your state. Persons convicted of a felony. In 38 states, we have laws that prohibit people who have been convicted of a felony from voting anymore. Pretty tough. In some states, it turns out that if you've been convicted of a felony, done your time, finished your parole, and all the requirements, then you can start voting again. But again, there's the resource to find out what the situation is in your state. The next one is for folks experiencing homelessness. One of the things that every voter registration form has in some shape or form is address. And so what you can do is tell people that are homeless that they can give a general address of where they are, you know, near the cross streets of such and such or southeast of something. If they give a basic idea of where they are, then that is usually enough for the purposes of voter registration. The second piece of that that's really tough is they also have to be involved probably with a social service agency that will agree to receive their voter registration card and then distribute them. A lot of them do it. It's difficult to do with a transient population, so a lot of social service providers have opted not to do that. I'm happy to say that a lot of community health centers serving the homeless do allow people to receive their voter registration cards, so that's pretty excellent. And again, there's the resource to get more information on that. Non-citizens. This is a tough one for a lot of people. It helps to have that form there so that it's very clear that you have to be a citizen to register to vote. We certainly recommend if you have people going through to become a naturalized citizen that they wait until they're fully through the process before they register to vote, because the process can take a long time and there's often, you know, bumps along the way, so best to wait. If you have someone who is a non-citizen and cannot vote or register to vote and would like to be involved, that is always a great opportunity to say, would you like to advocate for the clinic? They can also register people to vote even if they're non-citizens. They can help you with giving out information, encouraging others to vote. There's lots of roles in a volunteer capacity for folks that are non-citizens. And last, of course, is youth. If you have any questions about youth vote in your area, there's the resource for that. I have to say that they make wonderful volunteers. They're really excited often, and even if they're not going to be 18 at the next election, at the next election, they can still help out. If they will be 18 by the next election, they can go ahead and register to vote and then vote. Next. Interpreting for people at the polls. In most states, a voter who requires translation of materials to a language other than English can designate a translator for their assistance. Translators should not, and in most states are legally prohibited from being the voter's employer or union representative. That just makes good sense. They have to comply with the state laws, the translators, that is. Some states require that a translator sign a registration form and actually complete paperwork at the polls. So you really need to check out and see what the issues are around that. There's just a basic rule of thumb. The person providing assistance will not enter the voting booth with the voter unless the voter signs a document authorizing them to enter. Assistant will help the voter to complete the ballot, but may not try to influence the voter's selections and may not disclose how the voter completed their ballot. Next. Next slide, thanks. Bilingual signs and forms. If you have a large minority population in your community, it's a really great idea to work with your local electoral board and registrar to serve these minority language communities. And I'll give you an example. I was working in El Paso, Texas, which has a very large Spanish-speaking community. And even though the county was required by law to provide all forms and all information in English and Spanish, somehow they never did it until we started pressing on them and saying, hey, look, here's the law. You actually have to provide this information in both languages. And it wasn't until we really started pushing on them and making an issue of it that they finally started releasing the voter registration forms and the ballots in English and Spanish. So that's a great way to make a big difference. Next. If you need legal assistance, here are some resources for you. There's English and Spanish. Unfortunately, that I know of, and maybe you guys can work on with AAPCHO to find out if there's Asian language resources. At this point, I don't know of any, and I did some searches, but they may actually exist. They may only exist in your local community, so do some research on that. One of the things to think about is reminding people that all polling places must be accessible for disabled voters. If you're in line when the polls close at 7, you're entitled to cast your vote, so stay in line, don't leave. And signs should be placed wherever the polling places are for entrances to use by elderly and folks with disabilities. So those are the basics of protecting our folks, and our folks are the ones that may need protection the most, because sometimes the reason that they haven't voted is that they're too intimidated or that they've experienced barriers to voting. So our job is to try to do our best to remove those barriers and to make it as friendly as possible. And with that, I will turn it back to Lindsey to talk about GOTV.
Thanks, Yvette. And actually, that's a great starting point. You all may see abbreviated sometimes GOTV. That's a really common abbreviation in voter registration efforts, and that stands for Get Out the Vote. And really, this is kind of the conclusion of our presentation. I'll go through a couple more slides, but everything that Yvette has just talked about, from voter education to voter protection, you know, taking the time to provide those resources to your patients and work with your county board of elections, all of those things are going to help increase the voter turnout by removing barriers and educating voters about how to vote, what days to vote. That's going to help to get out the vote on Election Day. I mentioned earlier in the presentation pledge forms. This is something that is new for us at Community Health Vote this year. And it's a really, really neat resource. So what you see on the screen right now is just an image of our pledge form. This is one that you can order on chcvote.org. But there's also a link on there that you can just print out kind of a simplified version of this form and just print it out yourself at your health center. And there's really two ways that we're using this form. So first is there's some great research that shows us if somebody actually signs a pledge form and says, I pledge to vote on Election Day, they're more likely to actually go and do it. But what we're collecting on this form is contact information. So you can register someone to vote, but then you can also collect their contact information and say, hey, we'll remind you as Election Day nears and send you either an email or a text message to remind them about voting and to let them know, you know, here's where you can find where your local polling place is. So you actually don't have to do all of that. All we're asking health centers is to use these pledge forms, encourage patients to fill them out, and then you can mail them all to us at NACC, and that information is on the chcvote.org website, which we'll put up in a little bit. You'll mail it to us. We've got a contract with an organization that will be doing all of the data entry, and then we'll be sending out those email and or text message reminders to folks. So that's the first way that we're using the form. The second way is really, really exciting. This is going to be how we're going to truly track health centers' impact in turning out the vote. We can take all this data, and every state, I think it's every state except for the state of Virginia, has what they call a state voter roll, and they make that public information after Election Day. Usually it takes a couple of months after an election. But then we can access that data and compare, out of all these people who we registered to vote, you know, and we'll know that information from these pledge forms, out of all these people that you registered to vote at your health center, how many of them actually did go and vote? And so we'll be able to look at that data and figure out what was the success rate and show, were health centers able to actually increase voter participation in your community? So a really cool resource to consider adding into your plan. I hope you will consider it. And we'll send Albert maybe a link after the webinar that he can send out so you guys can directly access that page where you can download those forms and see how to mail those in to us. Just to recap on a couple of Get Out the Vote activities, many of these Yvette mentioned. She mentioned a health center. This is Clinica Family Health Services in Colorado is the picture you're seeing. This is the health center that has completely decorated their entire clinic in red, white, and blue. And they had a lot of fun doing it. It was fun for their staff, but again, really energized their patients and made voter registration kind of a fun activity, but also very nonpartisan. You know, it didn't have anything to do with a particular candidate or a party. It's just about, you know, supporting your people's rights as a citizen, the right to vote. A couple other ideas out on there. One of the things that Yvette had mentioned is making sure that you check with your local Board of Elections for materials in multiple languages. Something that I just learned this year is actually every county gets some federal funding to print the actual ballot on Election Day in multiple languages, but they only get funding based on the census and based on like what are the top languages reported for your area. So as an example, King County, which is here in Washington State, they only get funding to print their ballot in English and Vietnamese. However, the County Board of Elections uses other funding to print other materials in multiple languages. So they aren't just printing voter registration forms in English and Vietnamese, but they also have them in Spanish and Chinese and multiple other languages. So that's really helpful to find out, again, what languages are available in your community and how can you take that information and get it out to your patients to help them get out and vote. One other thing I wanted to mention here is on coordinating rides to the polls. This is another great service that your health center can provide, even if you guys aren't actually providing the rides, but partnering with other community organizations, seeing if sometimes your public transportation, public buses will give free rides on Election Day, and so making sure that we just promote that information to our patients. I know of a health center in Pennsylvania who they have put up signs in all of their buses. The health center has a bus where they provide rides for their patients to get to the health center for appointments. And so they've used that as kind of an advertising opportunity to promote a local phone number where patients can call if they do want to schedule an appointment to get a ride to the poll on Election Day. And finally, we just wanted to mention, make sure that you look up these important dates. As Yvette said, a lot of these things vary by state. So your early voting periods, the actual registration date, the actual day to vote in a primary, that all varies by state. So please look up that information. And again, I'll be putting up our website in just a moment, which has links to a lot of great resources where you can look up your state-specific information. I also wanted to encourage you all to consider participating in National Voter Registration Day. This is a national, nonpartisan effort that NAC has signed on to. It's on September 25th of this year. And if you go to nationalvoterregistrationday.com, you can get all sorts of free resources and materials so that you can participate. So this is a great opportunity if you're already doing voter registration, or even if you're not doing voter registration, if you could at least commit to doing it on this one day. Great opportunity for your community. Find out if other organizations in your community are participating and maybe partner with them on this effort. And then, of course, the upcoming fall election is November 6th, 2012. But again, I want to remind you all to think beyond just this upcoming election. We really want this to be an ongoing effort at Community Health Centers. How can we do this year-round and just incorporate it into your everyday operations? So here is our contact information. Albert has these slides, so I think he'll be able to send them out afterwards. But please feel free to contact us with any questions. If you need any help one-on-one, let us know your efforts. We would love to see pictures, any kind of write-ups that you could provide about what you're doing at your health center. And of course, if you are registering voters, you can let us know how many people you've registered to vote. We'll add those numbers to our national tally. And then here is the Community Health Vote site, chcvote.org. And there's really a ton of materials on there. Yvette mentioned earlier the Community Health Vote Toolkit. It's a free resource that you can download, and it has some great ideas about how to actually incorporate voter registration into the intake process or into other areas of your health center. We also have a widget on there that you can actually fill out a voter registration form online and print it out. We can give you a custom version for your health center. So lots of great materials there. But at this time, we want to go ahead and open up the call to questions. I believe Albert had mentioned you can use the chat box on the right side of your screen. So if you want to chat in any questions. And I see, Albert, you put on there that Max has joined the call. Max from ICHS. Is there a way we could unmute her line and hear from Max?
Definitely. Yes. So Max is here, and unmuted her line.
Great. Welcome, Max. I briefly introduced you earlier. I know you're with International Community Health Services in Seattle, Washington, and they've been doing a great effort this year with voter registration. So we'd love to hear if you're able to share a little bit about how you guys are doing it at your health center. Oh. And is Max's line, is she unmuted?
She is unmuted. I'm not sure if she's not able to hear us, but she does have the slides up. So I will give her a quick chat response to see if she's on. In the meantime, if any of the participants have any questions, yes, as Lindsey said, please enter them onto the right-hand column of the chat box.
And while we're waiting, too, if anyone on the phone has already been offering voter registration at your health center, if you're able to chat that in, we can hopefully try to unmute the lines here in a moment. We'd love to go ahead and hear from you and learn about what you've been doing this summer.
Okay, so we're just going to go ahead and open up the phone lines. Again, if you have any questions that you want to enter into the chat box, please go ahead, but I will unmute the lines for any open comments and feedback.
unmuted.
So everyone is unmuted now, correct?
Correct. Correct.
Okay.
And I don't think Max is unable, or she's unable to use a speaker or microphone, so I don't think we have her.
Okay. Well, hopefully we can have her on a future webinar, and we would love, again, to hear from anyone if you have been offering voter registration, or maybe if you start sometime in the next month or so. We'd love to, again, hear about your efforts and be able to share that with other health centers. One other resource I wanted to mention is if you go to chcvote.org, one of the tabs says webinars, and we had a great series of webinars this summer. It was 5 webinars, and on every single one we had different health centers across the country who have already been offering voter registration share about how they've been doing it and sharing, what worked, maybe a couple of things that didn't work, what they've learned from the process. So they're really a great resource, and you can go on there and listen to those recordings for free.
Okay, Lindsay, so we have one question from Sydney Liang from Lowell Community Health Center. He says, the pledge to vote form, since most people aren't able to speak, read, or write English, most of them don't have email or text. Is there any way to track other sources such as address or contact information?
You can track address and phone number. I'll tell you, at NACC, we unfortunately don't have the funds to do a mailing, but I know some health centers have independently been able to fund things like that. So you could definitely use those pledge to vote forms to collect, a mailing address or a phone number and try and follow up with patients, with a postcard reminding them to vote, or if you're able to get some volunteers together and maybe do a phone bank the week before Election Day or the day before. I think that's a great idea, and you could certainly use the data to do that. And you're also welcome, the pledge to vote forms that you can download from the website, it's in a Word document. So if you have someone on staff who's able to translate that into whatever languages are appropriate for your organization, you are more than welcome to take that form and edit it and make it your own.
Great. Thank you, Lindsay. So it's approaching 1:30, and we don't have any more questions in the chat box. And I will send this presentation to you all within the next 48 hours. And I just want to use this opportunity to thank Lindsay and Yvette. Your presentation was very useful. And for all the participants, thank you for joining in on this webinar. Your feedback is very important to us. So if you can, please complete the brief survey accompanying this webinar. Your suggestions will help you facilitate your civic engagement efforts. So I just want to thank you all again.
Thank you. Thank you, Albert.
Thanks.
Thank you.